Hi, everyone. I want to welcome you to our presentation, which is Care Case Management, a campus-wide approach. This is something that we've been working on here at UMass Boston and are looking to share some ideas that we've had as we work with students, both domestic and from across the globe. My name is Sean DeVoe. I'm the server here at UMass Boston as the Associate Vice Chancellor for Student Affairs and Dean of Students.
And I am Ashlee Carter. I am the Associate Dean of Students, and we are very grateful to be a part of the Global Summit on Student Affairs and Services this year. So thank you for having us.
A little bit about myself. I am definitely the more elder of the two. I have 25 years experience in student affairs. I've done a number of different roles, and you can see the work experiences I've had there. I've worked at many different institutions in the United States and many different styles of institutions, from graduate health science centers, small private, religiously affiliated institutions to a large public like UMass Boston. My degrees are from the University of Massachusetts Lowell and the Boston University School of Law. And as it says there, I did interim administration and consultant work for a number of years prior to arriving here at UMass Boston.
And again, I'm Ashlee Carter, the Associate Dean of Students here at UMass Boston. I have about half as much experience as Sean does, but I will get there eventually. I have a wide variety of experience within student affairs at this point, ranging from student conduct, residence life, orientation, and have spent a lot of time in the Title IX realm related to sexual violence and prevention. Those of you overseas, you probably are not familiar with Title IX, so maybe be grateful for that. But I've earned my PhD in higher education leadership management and policy from Seton Hall University. And I have presented my dissertation research geared towards looking at sexual victimization and college level sex education in various capacities. So that's just a little bit about us.
We wanted to share with you some background to our campus. As you can see from this photo, although this one's a little bit older, we are located pretty much in the Inner Harbor in Boston. We have approximately 16,000 plus students, depending on the semester. We are what is known in the United States as an access institution. So our students come from a wide variety of backgrounds, but especially within the state of within the Commonwealth of Massachusetts. Nearly 50% of our full-time undergraduate students receive significant financial aid from federal and state governments, and typically that indicates that they are coming from lower socioeconomic backgrounds. 60% of our undergraduate students are students of color, and we are considered the most diverse undergraduate student population of any institution in New England, which is the 6 states of New England, Maine, New Hampshire, Vermont, Massachusetts, Rhode Island, and Connecticut. And I believe we're considered the 4th most diverse institution in the United States. As it says there, 57% of our undergraduates are considered first generation, which by federal guidelines in the United States is considered the first student who is pursuing and successfully completes an undergraduate degree at the post K through 12 level. And English is not the primary language for over half of our students. And so you can see we are pulling from very diverse backgrounds, both domestically and internationally. And this really makes for a very rich community, but also creates opportunities and challenges for us as we connect with our students to be able to support them in student success. And I think all of those things feed into that #1 goal of our chancellor, which is to make us a leading anti-racist and health promoting public research university. And so you can see why this work that we're doing is of vital importance to the institution as a whole.
So a little bit about case management, which again could be a concept that folks are not familiar with, but within the scope of higher education, non-clinical case management is essentially we are trying to help remove barriers to help students make sure that they can stay academically successful. So it might be a central office or a central resource or a central service that many universities are using or offering students. But essentially, we believe that this work could help retain and help students persist to essentially get the degree that they are ultimately here for. We use the term non-clinical because most of us in the field, I mean, there is clinical and there is non-clinical case management. Most of the folks in the field in higher education, the way that we are talking about case management today, are non-clinical folks. So that means that we don't have certain confidentiality or privacy aspects to the work. You know, many of us are not social workers. Many of us are not psychologists. Some of us might be social workers, but again, we are working within higher education. We have more of a student affairs, higher ed background typically. So that's why we make that determination to essentially, you know, differentiate between clinical and non-clinical case management. Case management in general, the term has, you know, a long, excuse me, a long-standing history in fields like social work and psychology. You will hear the term casework in a lot of medical settings as well. And in terms of, again, higher education, typically there is a large focus on case management for students related to mental health challenges. However, this is expanded much beyond that. And Sean and I will go through today a little bit about what we see with our population. Mental health challenges are certainly a large majority or the core of our care casework, but it is anything from food or housing insecurity, academic challenges, again, anything that you can think of that might be impacting the student's ability to achieve, you know, their academic or stay in good academic standing, but that are outcomes outside of the classroom that are essentially interfering with that. So the objectives of a care case manager, at least how we define them, are to provide students with support and referrals, follow up with students and other community members who expressed concern. So that's part of the referral process, how we are introduced to students into case management, help students reach their academic potential, obviously the best that we can, and, you know, maximize those positive outcomes. And one thing to note is that when we do meet with students, when we're working with them, we obviously explain that there are limitations to what can be done. For example, we just cannot tell faculty that they need to do something for the student just because they are facing adversity in other ways. So that's part of the role as well. In terms of case management at UMass Boston, again, this is going to look very different for every type of institution. Some schools don't have any type of designated care case management within their university and might just have staff doing it without the title. Other schools, you know, we have, like Sean said, we have about 16,000 students. I'd say we have a smaller case team given our population, but again, we are very fortunate to at least have a care case team. So currently, we only really have one full-time designated staff member, and her role is case management. But obviously, she did not support 1,700 students individually herself. So, you know, we sort of spread the love in the Dean of Students office, essentially. But we did last year, as an example, we did have about 1,700 individual cases. So we worked with 1,700 individual students by triaging these cases. And that's ultimately what we're going to chat more about today. You know, essentially unofficially recognizing them as care case workers in terms of supporting that student. Just a side note on that, assessment and data collection for care case management or casework that you're doing is extremely important. By demonstrating and sort of telling our story, over the past 5 years, we were essentially able to advocate for a new full-time position dedicated to case management. So we are very excited to have another full-time staff member dedicated to doing this work, onboarding with us next year. For this academic year, we chose to really broaden the case team even more. Essentially, it was folks within the Dean of Students office specifically, but we have invited other folks in. And again, that's the theme of the conversation today. So we did this, you know, essentially we invited in somebody from the Disability Support Services office, athletics, and even some academic coaching areas. And we've also had what we piloted this year is specific caseworkers to work with specific populations. So for example, I work with graduate students and international students, and that is to help streamline the processes, streamline the conversation, and not have to bounce students around to multiple offices. Also new for this year, we had a a care case management intern that was with us for the full academic year. That student was only with us about 14 hours a week, but it was a huge help. This is a very low to no cost way to get folks into your space to be able to assist you with this type of work. So again, another side note, if you have a type of program like a social work program, or higher ed program or psychology or anything like that on your campus or at a nearby university, that could be, again, something that you could open the door to exploring in terms of having an intern that might be able to assist you in this type of work.
There we go. As Ashlee mentioned, we spent some time this year inviting and connecting with other departments and resources that are on campus, and were folks that we were making referrals to. We often say in our care case management that there are going to be things that we're not able to directly help with, but that we're going to connect you to someone who can help with it. So if you have especially in our cases here in the United States, if you have situations that deal with financial aid, if you have specific situations that deal with, if you're an international student who's come here and you have specific issues that deal with your visa, et cetera, we want to get you to the financial aid office, to the International Students and Scholars Office, because we want to make sure that you're getting the subject matter expert who can work directly with you and be able to support you in whatever the challenges that you're facing. In that spirit, there are folks like our Disability Support Services Office, our Department of Athletics, our Residential Life Office, which is our housing office, our folks in Student Multicultural Affairs, and the others that you see there, that have begun to work with us directly. And so if they have folks that are coming directly from their specific subpopulations in our or on our campus, they can directly support those students and work with them, and the student doesn't have to feel like they're being shuttled from office to office. And this is especially important when the support that the dean of students office may give or the main care office may give is actually a pretty administrative support function, whereas the disability support services office or the athletics department is really working closely with the student on a maybe weekly basis, maybe it's even twice a week basis that they're connecting with the student. And so they have that relationship already built. They're already working together, and the student knows and trusts the person that they're working with in that space. And then the support that comes out of the dean of students office can just be more communicated directly to us by the staff member who says, Sean, can we take care of this one piece? Absolutely, we'll take care of that. You keep you keep working directly with the student. Certainly, it is something that we can take over cases as needed, and there are times where things may get beyond the scope of one of our partners, and they feel as though it's a little beyond their abilities, and we are happy to take those cases. But for the most part, we're keeping students in their home offices where they are most well connected, and thus they feel like they're getting support and not getting that idea of what we often refer to as the bounce around campus, where you're going from office to office to office, getting one answer, one answer, one answer. In this way, we've created more of an opportunity for the student to have a really holistic connection with one staff member and really feel connected with that staff member. Additionally, one of the other things that we do is we use a case management software. It is called Maxient. It is actually one that was developed primarily for student conduct management, but you can develop it into different things. And so we have folks that use this for other circumstances, and we've built out opportunities for them to be able to use that. And then we cost share between offices. Additionally, trainings, professional staff development can be done across lines, and the benefit is multi-pronged, because not only are you potentially building out a good care case team that gets to work together, but you're also just building connections across your campus, and that is oftentimes vitally important when you reach that or when you connect with that one student who needs multiple support mechanisms. And even if you're going to keep the student to work with them, you know that you can reach out to this area or that area for some quick answers, for some in-depth consultation, and presumably some really strong resources as well. So things to consider is as you think about these is to think about your campus and your students. And one of the things that we've tried to do is try and figure out, okay, when we see things, and we do a lot of data review at the end of our years, where are we seeing the challenges that students are facing, and and certainly this is not intended to be a point blame at those offices, but where are we as an institution just not doing a great job explaining things, or where are we not getting a particular office connected with our students in a strong manner so they understand what those services are. That's one of the benefits of having this kind of care case management is you can figure out, okay, what are we seeing a lot of? We have a particular class this semester, which I've talked with the department chair about because I've seen a number of different students come in with a number of different concerns from a number of different classes. It's not just one faculty member, it is a multitude of classes. And so myself and the department chair have already talked through some ideas that department may bring forward to address some of the concerns that are already bubbling up regarding this one class. As you invite staff, we all know that sometimes one of the challenges can be you might have staff that are really interested in participating in something like this, but their supervisor believes that that is not within the scope of their role, or perhaps they're not a strong performer in the current work they're doing. And so the idea of actually adding more work or work outside the scope of their role is really not to their benefit. And so this is always something that we want to make sure that supervisors are talking to supervisors and really reviewing the opportunity before you jump in at the deep end. And then defining the scope of the work, because ultimately this is not you're hiring another person and basically stealing them from another office. This is figuring out how do we fold this type of work in effectively and in a way that supports the work that they're already doing with students. This is not an add-on from the perspective of a full suite of things that they're doing, but more in the course of their work with a student, how can they build this additional piece in and then keep others looped in on that work that they're doing with them. And then certainly the last bullet is most important. If you have unions on your campus, you're going to want to make sure that you are being thoughtful and thorough as you review this opportunity to make sure that you're not certainly violating any collectively bargained contracts.
Here are some sort of suggested resources and professional organizations that are all United States based, but again, they would welcome folks, from around the world, should they want to be part of these organizations. The one specifically I would point you to is the Higher Education Case Managers Association, which is HECMA. So this speaks directly to case management within higher education, largely focused on that non-clinical case management aspect. They do have free resources on their website. They have a fairly small annual membership fee if you are interested in joining. They have a national conference every June. Many of these organizations do have national conferences that I would encourage you to check out. Maybe not attend, since it would involve you coming to the United States, so that could be a haul for some of you. But like I said, even their website has a library of information and resources that are available for free that they would offer. Student Affairs Administrators in Higher Education, NASPA. This is another one, and this is one that's definitely dedicated to more than just care case management. But that is in our field in student affairs in the United States, that is one of the most respected organizations that is highly utilized and highly, there's many relationships that go into that organization. National Association for Behavioral Intervention and Threat Assessment. So this organization is great. They do discuss like the basics in the lower level care case management that comes into play with students, but they're also more looking at like more high risk, more threat, more students that might need specific types of intervention, such as quite literally being removed from campus, you know, because of certain behaviors, because of certain, you know, threats that they might be making. So that is another great organization to look at that. And then this is a link to just a white paper that both Nabita and the ACCA wrote together. And it sort of is just sort of a very basic document that takes you through, you know, what is case management? If you haven't launched on campus, how to launch it on campus yourself, you know, things to consider. It's a great resource. It's free. So if you don't currently have case management on campus, but you're thinking about it, that document can really walk you through, you know, the benefits of having it on your campus and essentially what it entails, you know, the definitions involved, things of that of that nature. So again, thank you so much for having us. Sean and I are more than willing to answer any questions that you might have. If you don't currently have any type of care case management on your campus, we would be happy to walk you through what that might look like. If you're piloting something, if you already have care case management on your campus, again, we'd be happy to answer any questions related to expanding your team and how to integrate others. So please do not hesitate to reach out. We recognize that student affairs and case management and this type of work may not be as well known across the globe. So anything that we can do to help, all of us are certainly here for one goal, and that is so that our students can get an education and do so successfully without things that are impacting them. So please feel free to reach out to us. And thank you so much for having us.
Thank you very much for the opportunity to speak with all of you today. Take care.